All right, let's go ahead and talk about major blood vessels. Now, we do have, here's a list of some major arteries and veins. It is ideal if you are able to match these big ones on a diagram such as this. Now, this diagram is labeled. Do you need to have every single major artery memorized? No, just the really, really big ones. For instance, the abdominal aorta, which runs right down the spinal cord until it splits into this diagram is actually calling it the gonadal artery. It's also typically referred to as the femoral artery, especially once it gets into the actual thigh. We're going to have external and internal iliac arteries that also branch off of this. A lot of the arteries down here in the lower leg, quite frequently, only people who specialize in the cardiovascular system and or are dealing with the lower leg tend to remember these ones. However, the popliteal artery runs right behind the back of the kneecap, and you can actually take a pulse from there. As you can the peroneal artery down here and the dorsalis pedis down here. That you'll take it right between the big toe and the second toe. And this would be the inner ankle. Now, obviously in the arm, the brachial artery is going to be important to know because that is where we are going to take a pulse. The radial artery and the ulnar artery are going to be important to remember. Part of the reason they'll be important is because they go hand in hand with the radial and ulnar nerves, and we very much so care about those nerves. But these two arteries are also going to be involved in a lot of hand conditions, from carpal tunnel to Raynaud's syndrome to a slew of other ones. So knowing them is going to be crucial for patient care. Obviously, as we get into the neck and head, the external, internal carotid, common carotid, brachiocephalic, subclavian, vertebral arteries, all of those are going to be important. I mentioned this when we were doing the heart, but the aorta comes off of the left side of the heart, the ventricle specifically, and as it comes up, it's actually referred to as the ascending aorta, and you have an immediate right and left branch into the right and left coronary arteries. At the top, it's referred to as the arch of the aorta, and you have your brachiocephalic artery as your first branch. That is going to branch into the right subclavian and right common carotid arteries. We have then the left common carotid artery coming off the aorta, and then the left subclavian before it comes down behind the heart and starts running along the spinal cord, becoming the descending aorta. The descending, actually I need to say that right here, the descending aorta, once it passes through the chest cavity, becomes known as the abdominal aortic artery. It is still the same artery, it's just in a different section of the body. So we give it a different name. When that abdominal aorta gets down into the abdominal cavity, it is going to start branching like crazy. And there are going to be a lot of important branches that come off of here. For instance, we're going to have the superior mesenteric artery, which is going to branch towards the mid-gut. What's going to be controlled by the mid-gut artery? Your intestines, specifically the small intestine and the ascending colon. The inferior mesenteric artery is going to go to the hindgut, so that's going to be things more like the transverse colon a little bit, the descending colon, getting into the sigmoid colon, all of which you may or may not actually know what those are, but we'll talk about them with the digestive system. The celiac trunk is going to be the artery to the foregut, so that's going to be things like the liver, the kidneys, the stomach, the pancreas, all of those upper organs. All right, I need to find a new picture. What we're going to do is we're going to go ahead and talk about the major blood vessels. Now, we do have, here's a list of some major arteries and veins. It is ideal if you are able to match these big ones on a diagram such as this. What this diagram is very fuzzily showing you is the branchings towards the kidney. We have the right and left renal arteries. We have the splenic artery going to the spleen. We have the gastric artery going towards the stomach. We have the hepatic artery, which is going to go towards the liver. Over here, it's actually showing the inferior vena cava, which is running right alongside the abdominal aortic artery, and some major veins coming from, or joining it, actually, I should say, would be the hepatic veins, the renal veins. So some of the major arteries and veins down here. Here we're going into that lower leg. We have the popliteal artery, anterior tibial, posterior tibial. This is the artery that when we're talking about deep vein thromboses, so clots deep in the vein forming, this is the vein version of this. This is the posterior tibial artery, but the vein version of this is the one that we are extraordinarily concerned about those clots forming in. Here's the dorsalis pedis, the plantar arch. Again, I mentioned a couple of those PowerPoint slides are going to appear several times. Here is one of the reappearances, just re-showing the coronary circulation. And then we have a major diagram of the veins, and you'll notice that the terms are pretty similar. We're going to have the external jugular instead of carotid, internal jugular instead of internal carotid. We're still going to have the brachiocephalic, subclavian, axillary, radial, ulnar, brachial veins, common iliacs, external iliac, femoral vein, popliteal vein, posterior and anterior veins. So the names are very similar, and they run in very similar locations as well. Now, this particular diagram is two-toning these veins. They are still in blue to denote deoxygenated blood for the most part. Remember, some veins are actually carrying oxygenated because it's part of the pulmonary circuit specifically. But the light blue is a more superficial vein, so they're closer to the surface, where the dark blue is a deep vein, and it is going to be further away from the surface, deeper in the skin. Here's the arm with those veins. Superior vena cava. Heart would be sitting right here. The head. Again, re-showing our coronary circulation because this is going to involve the veins as well, and then down into the foot. And this one is showing you these side by side, and as you can see, the artery and associated vein typically are running in the same location, either one on top of each other or next to each other. All right, moving into circulation. So one of the things you do want to know is how blood runs through the body. So you can start on the right side of the heart or the left side of the heart, whatever makes the most sense for you. I tend to start on the left. So blood is going to leave the left atria and go through the left AV valve, otherwise known as the mitral valve, and enter the left ventricle. It is then going to exit the left ventricle through the aortic valve into the aorta. It will then branch, getting smaller and smaller and smaller, becoming arterioles, going into capillaries. Capillaries are going to come out the other side and be venules. Venules are going to merge together, getting larger and larger and larger as they merge, becoming veins, and eventually that is going to dump into the left superior and inferior vena cava, which will dump back into the right atria, where the blood will then go through the right AV valve, otherwise known as the tricuspid valve, into the right ventricle, where it will leave through the pulmonary valve into the pulmonary arteries, to the pulmonary capillaries, to the pulmonary veins, and then back to the left side of the heart, the left atria specifically. Need to put that in order for the exam. Here we are showing the liver, hepatic artery attached to the aorta, the hepatic vein attached to the vena cava, and then we are going to have a hepatic portal vein, which actually attaches to the gut. And we'll discuss that in more detail when we get to the digestive system. Here's just a reiteration of our coronary arteries and veins. And this is the sinuses, the arteries and veins inside the skull.